name is Savannah Castaneda and I'm an LPN here at Bates, and today I'm going to be performing sterile wound dressing changes. I have all my supplies into the room. I have the order from the doctor, and now I'm going to go see Miss Lizzie. Hi Lizzie, how are you?
Good, how are you?
I'm doing good. I'm going to perform a wound change on you, okay?
Okay.
I came in about 30 minutes ago and gave you some pain meds. How you feeling?
I'm feeling pretty good.
Good, yeah. We don't want it to hurt when we go in there and clean it, so I'm glad.
Mm-hmm.
All right, Lizzie, I'm gonna put these gloves on. I'm gonna give us some privacy and we'll get started.
Okay.
All right, pulling my privacy curtain. I'm gonna move you up to a working height. My back is hurting in my old age.
I'm so sorry. Wait till you rotate my hip.
Okay, Lizzie, that's good for me. Are you comfortable?
Yep.
Okay, can you tell me your name and date of birth?
Yeah, it's Lizzie Thin and then XXXXXX.
Okay, what are you allergic to, Lizzie?
Shellfish, iodine, and ink.
Oh, perfect. Okay. Alrighty. Well, I don't know why I pulled that over. I'm going to pull this back. Let me know if you get cold, okay? I just really want to expose this wound and take a look at it.
Okay.
Okay. I'm going to put this pad down just in case we make a mess, which knowing me, we will.
Dang it.
Okay, and I'm going to open my sterile field here. Just want to get that biohazard bag out. Perfect. I know this is a sterile field, so I'm going to be mindful to not turn my back on it. I'm just going to pinch the top here. All right, Lizzie, I'm going to take this apart, okay?
Okay.
If I hurt you.
Okay.
I'm going to also just be really mindful of pulling the tape gently and away. I don't want to cause any skin tears. All right, I'm not seeing any drainage on this pad, so that's a good sign, Lizzie.
Sweet.
I'm not smelling anything horrible either. Okay, not very much drainage at all. And this is wet, but if it weren't wet, I would wet it just so that it comes out nice and smooth from the wound. I'm noticing some redness. The skin doesn't look too irritated. It actually looks like it's kind of healing. So I'm gonna go ahead and measure it now. Change my gloves. Measuring device here. All right, I'm going to do the length first. Okay. I'm getting about 10.5 centimeters for the length, and for the width, about 3. Now I'm going to get rid of this. Put that in the biohazard bag, and I'm gonna look for some tunneling. So I'm gonna simulate I didn't do that because I still have depth to check and also to report the tunneling. Thank you. Okay, we got about 1.5 centimeters. Now we'll look for tunneling, Lizzie. Okay, one right here, about 1 centimeter. A little tunneling here, about 0.5 centimeter. Now I can get rid of all of this. Okay. All right, Lizzie, now we're gonna do some sterile stuff. I'm gonna take my sterile water here. Oh, I'll wash my hands. Oh, I'm forgetting all the basic stuff, huh? I also want to note that I documented those measurements. So now I'm going to take my sterile water and I'm going to lip it to the numbers just so I know where we're at. Here, throw this away. I'm going to leave this here. Now I'm going to get my drape ready.
Mm-mm. Your dirty side's towards you.
Oh.
Remember, just the tops. Yep, so move your hands to the, yep, there you go.
Okay. I know this is not sterile anyway, so I'll adjust here. Does that look okay?
Mm-hmm.
Okay. And I'm gonna pop this onto here. Awesome. Okay, and I'm gonna put the rest of my sterile water into here. Okay, I'm gonna take my gloves off, do some hand hygiene, and I'm going to prepare the tape. Okay, I need 4 pieces. Come on. Okay, and I'm going to initial time and date it. Okay. I'm going to take these gloves off and I'll put my sterile ones on. Oh, hand sanitizer first, of course. Alright, Lizzie, we're almost there. How you feeling?
I'm okay.
Okay. You have an okay view?
Oh yeah, we're good. Step back a little.
Come on, glove. Okay, I can fix my fingers in a second.
Step back.
I'm gonna pause here. My gloves are backwards. I have an extra pair on the side over there. Would you mind giving those to me?
Yep. You wanna pass me some gloves to put on?
Yes. I know you're a medium girl.
Mm-hmm. Maybe you wanna help me put it on?
Yes.
Because I don't want to stop your video. Look at me keeping that sterile field in view.
Yes. Thank you
This
so
one?
much. Yep.
Okay.
Actually, not these ones. There's 6s over there, Emma. Do you see them?
Mm-hmm.
Okay, awesome. Thank you.
to step back. Nice.
Yes, these gloves were a lot better. Okay. Alrighty, now I'm going to go ahead and clean your wound, Lindsay. I have 3 sticks here. I'm going to go down the side. And then down the middle. Okay. And I have some gauze here that I want in the water. Or in the sterile water, of course. Okay, let it soak. Take it, rinse it over the garbage can. Alrighty, now I'm gonna go ahead and pack it. I have this piece that I really wanted. Okay, trying to pack this wound. It's not fitting in there too well. I know that the packing is not supposed to touch the outside of the wound for skin integrity issues, but in this instance we'll simulate that it's not touching outside of the wound. And I'm going to get rid of this. I have some packing here. Here we go. And I will take my big guy, lay it over top. Okay, now sterility is done. I can't talk. And I'm gonna tape. You all know what I mean. And this is the tape with my initials on it. All right, Lizzie, how you feeling?
I'm good.
Good. I'm gonna take these off now. Perform some hand hygiene. All right, I'm gonna close this up and I would dispose of it by the facility's policies in the biohazard bin. Tie it up. Cover you up, Lizzie. Are you comfortable? Are you in any pain?
No, I'm okay.
Okay. I'm gonna lower your bed for safety reasons. And I'm gonna give you your call light. Is there anything I can do before I leave?
Oh no, I'm okay.
Okay, awesome. The rest of this stuff I would put into the trash can. When I leave the room, I would remove the privacy curtain. I would perform hand hygiene one last time. And now I'm gonna go document my measurements, the color, the odor, anything about Lizzie's wound, and that's it.